Like Federica mentioned, today is our second EPHSA talk, and we have our two speakers already here, who are also our EPH alumni. We have our first speaker, Razia, who will be speaking about how to ethically use AI tools in research. Razia is a public health professional with specialization in epidemiology and biostatistics, recognized as top voice in research on LinkedIn. She passionately shares insights on enhancing research efficiently through AI tools. At Covidence, she is a community lead in integrating AI to enhance review processes. Additionally, she is working as an AI integration specialist and consultant, focusing on making research smarter through AI tailored to the workflows of client organizations and leading training to boost efficiency. She brings a wealth of experience from working in consultancy, academia, and both governmental and non-governmental organizations across Asia, Europe, and Australia. So welcome, Razia. We're really glad to have you as our speaker today. And we also have our second speaker, SM Hasan Bari. And Bari will be talking about beyond pills and policy, career opportunities in health economics for public health graduates. Bari is a medical doctor by training and an EPH alumnus, currently working as an associate health technology assessment HTA analyst at NICE, UK. His academic background includes a double master's in public health with specialization in biostatistics and epidemiology, with over 5 years of experience in public health sector and a strategic shift to pharmaceutical industry for past 2 years. Bari's career trajectory reflects a deliberate move towards integrating health economics with broader health care objectives. Bari has been involved in public health programs and research projects across organizations like USAID, WHO,
Doesn't matter. No, you just
UNFPA, and UNICEF New York headquarters, and the London School of Hygiene and Tropical Medicine, leveraging his experience to make significant contribution to global health initiatives. His commitment to advancing healthcare is also evident in his scholarly contribution and accolades, such as WHO TDR Fellowship and the Erasmus Mundus Scholarship. I welcome Bari as our second speaker for today. And before I invite our speakers for their talk, I would also like to share about the flow of our program today. First, our first speaker, Razia, will be given 20 minutes for her talk, and then Bari, our second speaker, will have 20 minutes, and then we'll open the floor for our audiences to ask questions to our speakers. In the meantime, if you have any questions to our speakers, you're always welcome to use the chat function and write your questions there. At the end, we'll open the floor for our questions and answers session. So, and also one last thing, I'd like to request everyone to stay like a few minutes after the session ended, because we would want to take a group photo. Last time we missed it, so I want to make sure that we have it this time. Yeah, so I would like to start with our first speaker, Razia. The floor is yours.
Thank you so much, Saja, for the great intro. And I don't think I have to say anything further about myself. So maybe I can kind of relate it with the topic, though, my intro with the topic. I hope my screen is visible.
Yes.
So regarding AI tools in research, so I would say that it's EPH due to which I developed this interest, mainly the internship. So my pathway was EpiBio, and I interned at Cochrane Center in Paris. And the topic that was given to me, I did not choose it, but it was given to me was to evaluate AI tools in systematic reviews, that how these tools are evaluated. At that time, it was 2019, and these tools weren't that common. So I had to go through a lot of tools, like there were around, I think, 200, 250 AI tools for, no, just tools for systematic reviews, and that included a lot of AI tools as well. So when I went through all those tools, I came across such amazing tools. And I started sharing that with my friends, with my colleagues, and they were very impressed. They were like, "Oh my God!" I saw a lot of interest in that. So I also conducted some sessions back then, and then all of a sudden in 2019 we had this chat GPT. 2022. And I started experimenting with it a lot, and then a lot of tools started coming in, and I started posting about those on LinkedIn. I saw a lot of interest, and so I just kept on exploring them. So that's my background on AI, really AI tools in research and ChatGPT in research. Now, before jumping really into AI, let us take a step back and think about how the way we have worked has evolved. So there have been four major era defined by the way we work. And over the course of next 10 years, more will change around the way we work than has happened in the last tens of thousands of years. The hunter-gatherer age lasted for several million years. So this was an era where humans primarily survived by hunting animals and gathering plants for food. Then agricultural era that lasted several thousands years, and this period began when humans started to domesticate plants and animals, leading to farming. Then the industrial age lasted for centuries, marked by industrial revolution, where manual labor was replaced by machines. And now the information age has lasted just a few decades. And this era is characterized by the digital revolution with the creation and spread of digital computers, the internet, and information technology. So, which age are we living now? We are on the cusp of our next great era as species, and this is what I call an augmented age. In this era, your human capabilities are going to be augmented by computational systems that help you think and robotic systems that help you make, digital nervous system that connects you to the world far beyond your natural senses. In all of these eras, did you notice how hunter-gatherer era lasted for few for millions of years, and then the agricultural era that lasted for thousands of years, lasted for centuries, and then information era that just lasted for a few decades. So the pace, what I'm trying to say is that the speed at which the duration of these eras are changing is exponential. And in no time, we can expect things to change significantly. So this is from a book, The Coming Wave. And it tells that the computing power, which is basically the power that AI needs to learn and think, the power that it needs to run has grown incredibly fast. And when I say incredibly fast, so it has grown by 9 orders of magnitude in the last 10 years. So let's sink in 9 orders of magnitude in the last 10 years, which is like saying when you took one step in in 9 steps, and each step takes you 10 steps further. So by the 9th step, you would leap towards revolution, I would say. So basically, what I'm trying to say is that it's like going from crawling to running to flying in a rocket in just no time. And that is why I think that this technology will really transform a lot of our society. And so even you feel like, oh, that is not for me right now, I am a bit underwhelmed. I'm not impressed by what I see. In 6 months' time, you will be completely overwhelmed by what you're going to see. Now, how these things apply to the field of research. For that, once again, I want you to think of back in time when research was performed in libraries, when you would have to read through physical books and in order to gather the data that you were looking for. This was the researching environment until the introduction of Google. So because Google took all of those individual books and articles and uploaded them online, creating a universal, easily accessible digital library. And now, where we are currently is simply the next phase in the evolution of research, because much like how Google took all those individual books and housed them in one area, AI has taken all the individual online sources and pulled them together in one place where it intellectually process it and conversationally deliver it. But why I'm talking about all of that? So 25 years ago, looking up sources online on Google, Scholar, or PubMed did not seem intuitive. It took us a couple decades to build those intuitions, those understandings. Now that we have AI apps that are remarkably different and more powerful than traditional online tools like Google Scholar or PubMed, we'll need to build those new intuitions. And the sooner we do it, the better off we will be as researchers and academics. But what are these intuitions that I'm talking about? So while AI has improved the quality of work, and this is something I'm based on a lot of research, where do we draw the line? So the image on the left-hand side that you'll see is from a study from in BCG, which is Boston Consulting Group, where consultants either used AI or they did not use AI, or they used AI, this red one, AI with additional training. And they did it for 18 different tasks, selected to be realistic samples of the kind of work done in an elite consulting company. Consultants who used AI, they outperformed those who did not by a lot on every dimension, every way they measured performance. Consultants using AI, they finished 12.2% more tasks than on average and completed tasks 25% more quickly and produced 40% higher quality of results than those without. But here's the catch. On some of the tasks, AI is immensely powerful, and on others, it fails completely or subtly. And unless you use it a lot, you won't know which is which. And this is why this is what I call developing those intuitions. The image on the right you see here, think of it as a castle with uneven walls around it, and the walls shows what AI can do and what it cannot do. So tasks inside the AI are those that are easy. Tasks inside the wall are those that AI can easily perform, like writing a poem. And the tasks outside this wall are the tasks where AI find it difficult to perform. So, for example, writing the same poem, but with the exact words, because the way AI calculates is different from the way we calculate. So surprisingly, AI finds some tasks easy, like coming up with new ideas, which struggle with simple things like math problems that we would expect it to do well. And so we need to be aware of what to use AI for and what we need to be cautious about. This is a poster I created for LinkedIn regarding AI implications and regarding the ethical implications of AI-assisted research and the ways to avoid those concerns. I'll just go through a few of them one by one. So validity of sources. One of the things that we talk about very often. So imagine you're doing a science project on plants. You ask AI for help. It gives you a lot of information. But what if some of those information was from a website about space aliens using plants to communicate? AI, like any computer program you're using to find information, doesn't always know the difference between a science book and a storybook about chatty AI plants. Why? Because it looks for the patterns in the information it was trained on, not whether that information is true or not. Now, how can you make sure that you're only getting the science facts you need for your project and not the alien stories? So first, you need to obviously double check the information AI gives you. And second, use of reliable, if you're using ChatGPT, use the reliable plugins that work with LLMs to make sure that you get the relevant information for your project. So these are some resources. So if you're using a ChatGPT for literature search, you can use these alternates, which are more reliable. And if you're using ChatGPT, you can actually use these GPTs, or you can use plugins as well. These are the lists that you can, I keep posting about on LinkedIn. And also, I think if you go to my LinkedIn profile, you can download one cheat sheet for free. And this cheat sheet has all of that. And if you want to download any paid thing, you can just message me and I'll give you a discount code for that, EPH discount code. All right. So next, research misinterpretation. So here, let's say that we are a team of researchers that uses AI to analyze data from an experiment on a new drug. The AI might be great at identifying patterns and correlation in the data, and this is the preliminary task that it excels at. However, suppose the AI, based on its programming, find the strongest pattern, suggests that the drug is highly effective. But in reality, that effectiveness is only significant in a specific subset of the population. Under certain conditions that the AI did not or could not take into account. So if researchers do not scrutinize these results, they might overlook some important nuances like potential side effects of the drugs and lack of efficacy across a broader population. So this is a misrepresentation of research because AI's conclusion was too broad and not nuanced. To avoid that, the final interpretation of the research findings must be conducted by a knowledgeable human researchers. They would consider the context of the data, compare it with existing scientific literature, and apply the expert judgment to understand the full implications of the research findings. This ensures that the conclusion drawn are reliable, accurate, and contribute meaningfully to the scientific community and public knowledge. Just to the admin, I just want to say that, sorry, coordinators, when I have 5 minutes to let me know, so I'll make sure to kind of not go that much in detail about everything. For biases, actually, let me show you how prompting AI for certain images shows it inherent bias issues. Why would a nurse be a female? Why would a lawyer be a male? So these are the images that were created by AI on human prompting. And it completely shows the biases that it has. Why should a terrorist look like this? Why should a prisoner be a black? Why a cleaner looks like this and a nurse looks like this? So when the human prompted, it was not mentioned how these people should look like, but AI has learned from most images from the internet and made these images based on that. And also, there's a case where AI was used to screen candidates for a job. It screened out all the female candidates. Why? Because of the historical patterns of male being in the job industry for such a long period of time. Now, how all of that applies to research. So if the AI only learns from certain type of data, say it's trained on medical research from some parts of the world, mainly high income, it's trained on a lot of research data from the white population. So it might not work well for everyone. So whenever you use AI, look closely at what the AI is saying and if it fits your context or if it fits your research. Plagiarism is one of the most common concerns that I hear about all the time. So although generative AI, as I mentioned previously, processes a lot of information on the topic before delivering a response, so mostly these responses are summarized, paraphrased responses, but there's definitely a potential for plagiarism. For example, think of a researcher who's working on research paper about climate change. They use AI to generate some of the content, including summary of recent findings on the sea level rise. The AI, drawing on its vast database, provides the text that closely mirrors a published paper by a leading climate scientist because it's learned from the material. The student, not realizing this, includes that text in their paper. Here's where the risk of plagiarism creeps in. the AI has inadvertently copied the style and the substance of that scientist's work. If the student does not check, or if the student does not rephrase this information, and most importantly, fails to cite the original source, they could be accused of plagiarism. So to avoid this, a student should use AI for brainstorming different aspects of climate change to explore rather than to generate sections of the papers. So, and after using AI, gather information, cross-reference all the AI generated text with the original source. And for that, I am telling you to use the plugins and the GPTs. So these are very helpful. And before finalizing their paper, run it through plagiarism checker to ensure the content is original and properly cited. When we do research with people, like the primary research, we have to follow ethical guidelines to make sure everyone is treated safely and fairly. AI can manage data and find patterns, but it obviously cannot weigh of responsibility that comes with the informed consent with a respect for autonomy. So when using AI in primary research, we have to always check that we have the consent from people if you're studying them or their information, and make sure that the study participants are aware of the study and agree on what you're doing is safe and fair. Dependence risk, which is what the most scientists fear, and they aren't wrong in that. So imagine a doctor with a new AI-powered diagnostic system that analyzes symptoms and suggests potential illness. For a patient with persistent cough and fever, the AI might indicate bronchitis. However, a doctor is aware of a flu outbreak in the area, and knowing the patient has not received flu vaccine would consider these contextual factors. Despite the AI suggestion, the doctor will decide to run a flu test to rule out influenza based on their own knowledge of the current public health warnings and the patient's medical history. So this example shows how important it is to, importance of integrating AI with professional insights and the contextual awareness to ensure accurate and reliable medical assessment. Now, this is the last ethical concern that I'll talk about, and public health, since we're all studying public health, is the most relevant one. So here I'll give you an example again of flu, but in the public health context. So a public health department that uses AI to analyze social media posts for early signs of flu outbreak. The AI noticed a surge in flu symptoms in a particular city and sends out an alert suggesting a potential outbreak. However, what AI doesn't know is that the city just hosted a marathon, and where participants were talking a lot about their post-race flu-like fatigue, not an actual flu virus. If in this scenario, if the health department acts on the AI alert without context, they might issue a warning or start a vaccination campaign unnecessarily. So to avoid this, they must cross-check the AI findings with other data sources like hospital reports or pharmacy records for increased medicine sales. So this is basically the extra step that ensures that the public receive the accurate health information, avoiding any unnecessary panic or also the resource misallocation in this scenario. Okay, so enough about the ethical implications and how to avoid those. Let's talk about how actually to use AI. So number one, use AI for structure and not for content. And here's how Mushtaq explains it. So when it comes to AI apps, understanding the difference between structure and content is crucial. It's a bit tricky though. So if you're working on a journal article, you email the editor of that journal that you're trying to be creative with your next article, and you tell them that you will write in a form of a Shakespeare sonnet or a rap song. If editors are polite, they may tell you to stick to the structure of articles the journal has published in the past. Otherwise, they could just tell you something like, "Have you lost your mind?" Within an academic field, research articles have a predictable structure. Anyone wishing to publish their research will have to adhere to that specific structure. Then you tell the editor that, okay, my article, okay, fine, but my article will contain only predictable results. Again, the editor is unlikely to be impressed. That's because an academic article must have an original, a novel contribution. So, and such a contribution cannot be predictable at all. So, an academic article basically has a predictable structure but unpredictable content. And so, yes, Saja.
Just letting you know that you only have like 2 minutes.
Oops, okay. I will then just I'll speed up a little bit. So basically, yeah, we can use it for predictable content, but predictable content for purposes of little use, but a predictable structure could be very useful. And treat AI as research assistant, not a supervisor. So you give instruction to a research assistant and you receive feedback. You double check everything that a research assistant tells you before you put them on the paper. So yeah, don't call it a research supervisor. These are some of the research steps where you need to know that where AI is capable and where the human expertise is needed. And these are some of the journal guidelines. Again, that's based on everything regarding the ethical considerations that I've already told you. And you need to disclose where you have used AI. You can use this barcode, so it gives you a curated guidelines of how the articles have ethical guidelines that the articles have given you in academic publishing. And finally, in conclusion, I would like to say that like iPhone changed the way we interact with internet, AI will completely change the way we interact with everything. And knowing how to use it will make you ahead of that curve. Because what you need to understand is that everyone will be using these technologies anyway in a couple of years, but use it better than everyone else because the way we do things will change, the way we use knowledge will change, the way you conduct research will massively change. So, but we need to educate ourselves on how to use these tools. And to help you with that, I'm also in the process of designing some workshops. The purpose is to give you a leverage to start using this technology in the best way possible. And this is why I'm planning to conduct multiple sessions to give you that leg up. So you could start using this technology more efficient and better than everyone else. There's a link to join the wait list for the workshops. And on the left-hand side is basically the actual motivations to work on these sessions. So I basically try to keep up with AI research, and every day we have new paper with insights, but 99.9% cannot, people cannot really keep up with those research. So when I hear things like, talk to ChatGPT like humans, AI cannot replace our jobs. AI cannot replace humans. I really feel that people need to be educated better. Well, I did tell you to talk to ChatGPT like a research assistant, but no, not a human research assistant. You need to know that the language that ChatGPT understands, you need to know that language. You need to know how to incorporate Markdown or XML formats to get the kind of the output that you want. And you need to know the techniques or the simple prompt tweaks that could change the ChatGPT output significantly. And for the concerns like do not use ChatGPT because it hallucinates, it makes mistakes, it doesn't give the response that we want it to give, and why it can't do a simple arithmetic problem. So you need to understand how these LLMs work and why do they show these kind of behaviors. I also received several requests from researchers to help them pick the right tool. So I'm in the process of designing such workshops too. So yes, you can feel free to join the waitlist, and please use this link for feedback too. Or if you can write feedback on the chat, that would be very helpful as well. Thank you so much.
Thank you so much. This is really, really insightful because, like you said, I like when the Chat GPT first arrived, it was a lot of people had this fear that they would replace it, and I think it's very pertinent for us to like know how to use them for our own good and so that we can excel. So I think a lot of us will have a lot of questions with this regards, so I'm looking forward to the question and answer round as well. Now I'd like to invite Bari for your talk. The floor is yours.
Thank you, Saza, and thank you everyone for joining this session. So today I'm going to discuss the exciting intersection of public health and health economics, especially focusing on the vast career opportunities that await public health graduates in the pharmaceutical industry and also in the non-pharmaceutical industry. So, at first, I want to discuss about what is health economics, and health economics is more about the economic aspect of health, and it is one of the vital fields that combines economic analysis with healthcare insights to improve decision making and outcomes. In the pharmaceutical sector, it plays a crucial role in determining how drugs are priced, how they are reimbursed by health insurance, and how accessible they are to the public. And in the non-pharmaceutical sector, it is more about like how a health policy is changing people's life. For example, the universal credit or universal health coverage, how those are improving people's life at the same time how those are saving money, because we know that every nations they have limited amount of money to provide the optimum level of health service. And where public health comes here, the essence of health economics actually lies in its ability to integrate public health principle with economic strategies, thereby enhancing the overall value of healthcare service. This interdisciplinary approach ensures that healthcare interventions are not only medically effective but also economically viable, and where the value of public health actually comes here, because it is more about leveraging the foundational knowledge. Public health graduates actually bring a rich understanding of healthcare system and also preventive measures. This knowledge is instrumental in analyzing and interpreting the broader impacts of healthcare interventions from an economic perspective. And we always want that perspective to be speeded up by evidence-based policy advocacy, because the skills in evidence synthesis and communication are pivotal at the same time, and they empower the health economics to inform and influence health policies and economic evaluations, ensuring that decisions are based on solid and empirical evidence. So here comes a more detailed analysis of what skill set or what career or sector are there for public health graduates. So if we look closer at the different sides of public health career, we know that some people come with quantitative background, and some people come with qualitative background, and some people have like equal exposure or more or less exposure in both the background, be it qualitative or quantitative. So people sometimes think that okay, health economics is solely quantitative. It actually requires people with a strong knowledge and expertise in quantitative areas, which is true to some extent, but there are also opportunities for people with qualitative background. So at first, I'm going to discuss more about the quantitative aspect, what kind of skills and what kind of opportunities are there for people with quantitative background. So first of all, I can say that if you are a biostatistician or epidemiologist or economist or data analyst, you need a strong foundation in statistical methods. And sometimes people come to me and they say that, okay, I'm mastering on SQL, on R, on Stata, SPSS, Excel, and whatever else out there. But I think it actually doesn't help for long run, because it is not necessary to be the jackal of all and master of none. I would suggest just be skillful in a certain coding or in a certain platform. If you like R, just develop your skills in R. If you like Stata, just develop your skills in Stata. But yes, whenever you have the better skills in a particular language or data analysis platform, you will eventually understand what is being analyzed in other platforms. So that I would suggest to the recent graduates or to the public health graduates. And secondly, I think a core understanding of the healthcare perspective, that's also very necessary here. You need to understand data, first of all, even if you have quantitative background or qualitative background, a basic understanding of data is very necessary here. And also you need to interpret the results of the evidence or results of the study which are published or which are out there. And it actually gives you the strength, like how to present or interpret your results to the wider audience. And I think like EPH already provides us those education, those knowledge through the first year and second year of their courses. So yeah, I already told that people who have quantitative expertise, be it data analysis or economic modeling, they might get leverage or they might get preference working in the health economics or pharmaceutical industry. Now I want to focus about, like, okay, what about people who have qualitative expertise, why they fit in the health economics or in the pharmaceutical industry. So here comes my understanding and my insight. For example, like if you are very good at writing, if you are very good at analyzing qualitative data, if you are very good at communicating with people and patients, and also people who don't have non-medical background, then there are lots of opportunities for you. For example, uh, most of the time we need health policy analysts, and health policy analysts, they actually analyze the health data. At the same time, they gather the qualitative insights from published researchers, and they actually integrate or triangulate those findings in briefings or health papers. And that skills is actually not exclusive to people who have a quantitative background. That skills can actually be used by people who don't have quantitative background but have a good grasp of qualitative understanding. And so here I discussed about the health policy. And the next thing comes, I think, health communication or patient advocacy or medical liaison. So in those cases, actually, you can employ your knowledge in communication. Like when we work in the public health sector, we know that communication is key while contacting people and patient and while making decisions. So when you want to employ or you want to use those knowledges, I think it is very much efficient to understand the patient perspective and also the perspective of the current policies regarding certain disease areas or the drug development areas. So I have already discussed the health policy aspect, the health communication aspect. And the next thing I want to discuss, like that there's a broad areas for knowledge management, and that also includes the systematic reviewing or reviewing existing literature. So whenever we actually enroll in EPH, we know that we go through a lots of modules. For example, basic epidemiology, the basics of biostatistics, and at the same time we learn a lot about like literature searching and systematic reviewing. And if you gather a bit of knowledge, and if you can encourage yourself to explore more, I think there is a huge areas to work in systematic reviewing and knowledge management within the health economics and pharmaceutical sector. So and it also includes medical writing. So if you search the keyword medical writer pharmaceuticals, you will see lots of job opportunities only designed for medical writers and knowledge management specialists. And here comes another things, which is project management. So project management is also very people's skill. Like it is not only about managing project, but it is also about managing people and managing stakeholders. So I think like when we do our internship, or we do our thesis as part of our EPH journey, that time actually we get the real essence of working in real life settings, or working in a research project, or within an organization, or within an institute. And that actually gives you the opportunity to learn about project management as well. And another things, what I have noticed from my career, and that is like sometimes we don't question ourselves. I think that skill is very much necessary to build a career in public health, not only in health economics. So just asked one question, like if you are a recruiter, and if you are going to hire someone for a certain project which requires certain skill, be it health economics or project management, or knowledge management or epidemiological research, just ask yourself like what skills and expertise you look for a candidate. And when you will ask this question, actually you get lots of answer for yourself. And you will understand like why a recruiter, or why a job provider will hire you if you have those skills, or if you don't have those skills. So yeah, you need to reassess your skills and expertise time to time, so that you understand like where you should have developed your skills, and you should have learned some certain areas and of expertise to prosper in a certain career. So here I want to finish with a positive note, that there are lots of opportunities, and do your homework, reach out to your alumnus, and also ask them question like what kind of support, or what kind of advice they can provide you, because sometimes we don't do our homework, and we just jump here and there, and we actually waste lots of time. So reach out to people, and there is no question about a stupid question. Like, what is a stupid question? The answer is no question is a stupid question. So ask any question, and don't feel demotivated, because people are busy, but people are also out there to help you out. And feel free to ask any question if you have. And my career is very diverse, I would say, because over the time I worked in public health program, but now I pivoted to pharmaceutical industry and health economics. And yeah, if you have any question, feel free to ask. And thank you, Sajja, for the reminder.
Thank you so much. It was really, really nice listening to your talk, and also it was, I think, when we think about health economics, we have certain perspective about it, and the job that it has. So I think it was really nice to hear about various roles we can have under the health economics, that it's a wider umbrella and it has a lot of job opportunities if we try to get into this sector. So it was really lovely hearing about that. And I would like to open the floor for our questions. So
And
yeah,
I have a quick input.
yeah.
Sometimes we actually think that health economics, but I would say people to look for pharmaceutical industry other than health economics. Because why I use the word health economics in the presentation or in my title, because I thought that okay, this is what people think about, but I want to change that perspective as well. Like, don't think about health economics, just think about pharmaceutical industry, and that is the point, or that is the time you can see the bigger picture and where you can fit in. Thank you.
Thank you. Thank you to both of our speakers. Yeah, I'm opening the floor for question and answers.
You can unmute yourselves and just ask a question, or like raise your hand or write the question also in the chat.
I think I have a question to Bari. I mean, I understand. Lady, are you about to ask question? Oh, okay. So, like you shared, you made a shift from public health to pharmaceutical industry. I'm really intrigued. Why did you decided to shift? Because you did your biostatistics and epi. I understand you didn't. It was not like in Krakow, so we have more focus in HTA. So I'm very interested to hear why did you shift to this industry? Sorry, you're on mute. Sorry.
Sorry, can you hear me? Yeah. So, okay, my history is a little bit complex, I would say. So when I joined EPH, my second year was in Krakow. And when I was in Sheffield, like I felt I'm more interested in EpiBio, and I just sent an email to UPH like, can I shift my pathway to Krakow to Paris? And they said, okay, we have a place for that, and we can arrange that. So that's why I moved to Paris, and I started having my session in EpiBio. But why did I moved from public health to EpiBio and then again to health economics? That actually answers the context here, because in my previous experience when I worked in Bangladesh and other organizations, whether it is Newark, like that was more about program of public health, for example, vaccination or sexual and reproductive health, and those projects or programs are widely based in the developing countries. So either it is in Middle East or in Africa or in Asia. And so I am based in the UK, and I was actually looking for public health opportunities in the UK. And when I was searching for those opportunities, I came to know that public health programs are more condensed around the research organizations here or universities. And I wanted to work something which is more tangible in terms of stability here, because being a expat or migrant, I was looking for something which is more stable. So, but I'm not discouraging people who are interested in public health research. I'm just explaining my situation. And when I look for opportunities that which type of job or which type of opportunities can give me more stability, as an expat or migrant here, I found that getting associated with pharmaceutical industry can be a great opportunity for me. So I had my background in analytical field, which is epidemiology and biostatistics. And at the same time, I had the public health exposure, and I started looking for the health economics related job, and like help. Sometimes the health economics related job, they ask for analytical background, and I think my bio and AP background worked here to get that kind of opportunity. But people who don't have analytical expertise, they can also work in pharmaceutical industry, because one of my friends, she is working as a systematic reviewer slash medical writer in a pharmaceutical industry, and she actually doesn't have the core analytical expertise or exposure, but she had the basic of epidemiology or biostatistics in her previous studies. So yeah, that can also work here. And yeah, you may ask, like, why you didn't go for public health program here in the UK. So when I looked for NHS jobs and other things, I also found that the public health opportunity is a little bit limited in terms of like the context of developed countries. Because if you are from a developing countries, you know that those programs are more about implementing the broad objective, but here it is more about drugs, pharmacies, reimbursement, insurance, and the public health scenario is quite different compared to developing countries with developed countries. So that was one of the reasons. Thank you. Sorry if I took too much time.
No, thank you so much for answering that question. I think it was really helpful, and that is, it's very important for us to get the perspective of people who have gone through the process. So I think it is really helpful. Thank you so much. Is there any question?
I had a question, if no one else had one. So this is for Razia. I thank you for your interesting talk. I think it was really cool, especially talking about the different ways that we can use AI and like where we should use it and where we shouldn't use it. I kind of had a question regarding that. So I know, we talk a lot about learning hard skills such as like programming and learning and being familiar with the language. Yet AI tools are very good at helping us with that, especially like writing code. Like you tell it, oh, I have a database with this and I want it to do that. What I was kind of wondering what your thoughts were on that kind of use of AI. Yeah.
Thanks. So just as I think Bari mentioned that when you're using a tool, so if you're learning statistics, try to focus on one language. I kind of agree because now AI can do a lot of coding. So we would need more specialists here, those who have deeper knowledge, basics, everything AI can tell you. So I used AI for, so when I was studying R, initially, I had a very basic knowledge. I used AI for creating visualizations. ChatGPT, when it came, the 3.5 model. And since I had very basic knowledge, I struggled with that a lot because it used to give a lot of errors. So that's when I realized that even for using such tools, such AI tools for these skills, we really need to know how to use them. What I suggest in this case is that if you get a chance to get basic knowledge of data analysis tools like Stata and SAS, these are great because once you know the language of one software, it's easier to learn another. But I would agree that you need to be a specialist in one tool so that to make sure that AI doesn't really replace you. So also sometimes people ask me a lot that do we really need to now focus on hard skills? since we have ChatGPT doing all the coding for us. When you are prompting ChatGPT, there's a specific format that you prompt in. So what coding gives you is that structure to think. If you have used any data analysis tool, you would know that it gives you kind of an edge of structuring your code, how to strategically think which thing to put where. So this really helps you in prompting ChatGPT as well. And I would say that combine this with soft skills. For example, problem solving is a very, very major thing that you need to be specialized in, I would say. So if you know the real world context and if you have the ability for creative problem solving, you combine that with the hard skill, and then that really gives you an edge. And the way you do that is that when you identify your domain area, you identify the industry. For example, if you're interested in climate change, you see which companies are working on it, for example, WHO or CDC, whatever. You look at their relevant articles, relevant blogs, and then see what problems they're facing, think of a solution, and also the articles that are published, what challenges are there in the field, and then what are the solutions. And once you know all of that, write your solutions, write the challenges and solutions, and this way you will gradually develop your expertise in that. And then that is the time that when you go and pitch yourself, you will have an edge over others.
Thank you.
I want
It's very
to add a
insightful.
quick thing about what just Razia said. Like, I also take help from ChatGPT. For example, when I brainstorm about a certain topic, like I note down 5 or 6 points, and I tell ChatGPT, okay, this what I have brainstormed, and please provide 5 or 2 additional perspective to what I have already brainstormed. And that's time actually ChatGPT provide, okay, you have done this, and maybe you can talk about 2 more of these points. So that's why I think ChatGPT complements your thinking and what you are trying to convey.
Thank you so much. Thank you for the answer. And if we have any more questions, now is the right time. And if you don't, we'll just I'll just request everyone to if you can open your videos, we will just take a picture and then we'll end the session today.
Yeah, and if you don't want to be in the picture, you can just remain with the camera off. And I also really want to thank the 2 speakers today. You could feel, even if virtually, the passion. I really, really appreciate your input and the energy you used to talk about this topic. So thank you so much. So now, for the one that want to be in the picture, just smile so that I'm gonna press the button and take the picture. Big smile. Okay. And thank you again for the speaker and also for everyone to be here, and see you all next month.
Thank
See
you.
you next
Bye.
month. Thank you so much.